give us an update. I'll give the numbers here, and then we'll turn it over to you guys. As of today, we've had 18,155 total cases in Morgan County. That's an increase of 944 cases, or about 5.5% this week. As reported by the Alabama Department of Public Health, the moving 7-day percent positive rate is 22.5%, and approximately 42,210 individuals have completed their vaccine series in Morgan County. And I think maybe if there's good news, we're seeing that continue to creep up a little bit. We'll go ahead and hand it over to Kelli for an update from the hospital.
Thank you. Well, it's not good news. Our numbers continue to increase. Today we're at 74 inpatients, 1 presumptive, 10 in ICU, all 10 are vented. 15, we're holding 15 patients in our ER. 6 of those are waiting on ICU beds, 4 for our step-down unit, 1 medical, and 4 psych patients. Of the 74 we have, 16% are vaccinated. That's 12 people are vaccinated. 62 of those are not vaccinated. There's only 1 patient in our ICU that was vaccinated. All the other 9 are not vaccinated. We're continuing to see big numbers in our emergency room. You know, I want to apologize, I guess, to the community. We're doing the best we can. You know, there's a lot of long waits there, people waiting hours to be seen. A lot of non-COVID emergencies as well, but again, I give it to my staff. They're doing a great job handling that. However, they're a little overwhelmed at times, holding all these patients down there, and then just the influx of people coming in. We're still offering testing at Westmead Baptist Church Monday through Friday, 9 to 2. I'd rather you go there to be tested than come and wait in the emergency room to be tested if you can. But if you are sick, you know, and need emergency care, please come to the emergency room. We're still doing vaccines every day at the vaccine clinic. Well, I say Monday through Thursday, 973-2888 if you want to get a vaccine. We're still on red for visitation, trying to limit the amount of people coming into the hospital. We still need nurses. You know, I can't appreciate the staff that I have so much. Not just the nurses, everybody's doing a great job. I mean, it's a hard job that they have. I did bring with me a prop, Judy, this morning. I brought the pulse ox that most people talk about. I just wanted people to see this. This is how you determine your oxygen saturation level. If it goes below 90, we want you to come to the emergency room. We're still continuing to see people come in the 70s. And when you come into the emergency room and your oxygen stat is in the 70s, the chance of you living is really, really low. So all you do is slip this thing, you turn it on, slip it on your finger, and let it give you your number. Of course, mine is 100%, thank goodness. But if it goes below 90, you need to come into the emergency room. But please get your loved one of these if you test positive for COVID. If there's not one, you may have to share with somebody else. Just clean it really well for that. But I just wanted to show that, make sure people do that, because again, we are seeing people come in too late. That's the main thing that we're seeing. I think that's all I have this morning, unless there's any questions later.
No, thank you, Kelli. There probably will be questions. I'll turn it over to Judy.
Well, as Kelli has said, you know, a year ago, we really thought this time we were going to have good news. We really thought that there was going to be a lot of positive things that we would be able to say. But this has been a very daunting summer, a very daunting season. And, you know, and I guess for us in the healthcare industry, you know, it doesn't have to be this way. You know, this is not a war that this is a war that we can control. This is a war that there is some remedy for. And for whatever reason, we just are struggling to accept it. We're struggling to do that. And I guess those of us in the healthcare profession don't understand why. I mean, we certainly appreciate the people's rights to their decisions and their opinions. But, you know, the evidence is there. At noon today, the state health officer has requested that there be a moment of silence for the 12,000 people in Alabama who have lost their lives because of this disease. Unfortunately, while we're waiting to get to today at noon, we already have almost another 500. We have 12,416 deaths listed in Alabama. Folks, that's 12,416 of our own people in Alabama who have died because of this disease. As Kelli said, you know, our hospital rates are astronomical across the state. Currently, there are almost 3,000 people in hospitals across the state, and a lot of those now are children. You know, in Morgan County, as you have already said, listen, while we're having this moment of silence, there are 302 people in this county who have lost their lives because of this disease. And quite honestly, over a third of those have been this year, a year in which we had vaccine. I will tell you that Dr. Scott Harris, the state health officer, who is our commander-in-chief of the public health system in Alabama, you know, had a press conference a little over a week ago. Actually, it was a week ago Friday, in which he became very emotional about the situation in Alabama. You know, and I think the one thing that most of us got out of it was, we quite honestly, even though, you know, he talked about how discouraging things are, it sort of inspired us to go on. But another piece of that is, there is so much that we can do. You know, we've got a worn out hospital system, we've got worn out medical staff and support staff in every field that we've got in, and we could do something about this. And so, you know, it just tends to be extremely discouraging. As you said, the numbers continue to go up. There's no reason for the numbers to continue to go up, but they are. You know, and what happens when we have to say to you, we don't have a bed. We don't have medical staff that can take care of you. I know that many of you probably saw on the news last night where some of the UAB nurses decided that they weren't going to clock in for a while. People are exhausted. Not only are they exhausted, we're making decisions about what they're going to do with their lives. While some of you were at the lake and some of you were having picnics, many of them were in the hospitals and in medical facilities unexcused, because they had people that they had to take care of. And as Kelli also said earlier, you know, a lot of other people are having to be turned away or having to wait long periods of time to get the medical care they need, because the hospitals are so bombarded with taking care of COVID. And on the other hand, people are also very, very afraid of, you know, of going to the hospital for fear of having COVID. So I guess what we don't understand is, why have we made the decisions that we're making? Why is our community and our state at the bottom of the rung in the nation? You know, why are we there when we are as bright and capable as you know, any state in this nation? So why are we there? You know, the things that we know, regardless of whatever else you hear, the things that we know was that from February until May, once the vaccine came out, our numbers dropped drastically. Our caseload dropped, our hospitalizations dropped, and our deaths dropped. And then all of a sudden, when that happened, we sort of waned off of getting vaccines. And as the vaccine numbers dropped, then we had a bounce effect. The deaths went back up, hospitalizations went back up, cases, and they continued to soar. As Kelli was talking about the numbers now, the numbers that we're talking about today are numbers that represent what's going on in the last 2 or 3 weeks. It's represented the 2 big events, the Rock the South and the Trump rally that was in the Coleman area. It's represented getting out and doing things that we wanted to do, and we all want to do that. But let me tell you what happens from here. From here, we had ball games this weekend. We had a big holiday this weekend, and it was great that people were able to get out. You know, I wanted to get out, and I did get out some too with the mask on. But you know, the numbers from this we will see in the next 2 to 3 weeks. So we're not at the end. We're fixing to probably have another peak. Now, let me also say, and people will say this, you know, at some point, you're right. At some point, we'll have a group vaccinated, and we'll have a group that have had the disease, and therefore we'll have some natural immunity, at whatever level that is. But what price are we going to pay to get there? Do we continue to have people die? Do we continue to have people in the ICUs, or to have long-term, we call it morbidity, long-term conditions as a result of this disease? What price is natural immunity worth when we've got a vaccine that clearly we know, works? I've already said, you know, a lot of our other medical needs have gone unmet. A lot of people can't get into the hospital. A lot of people are putting off basic health care, mammograms and follow-up of conditions that they have just because they're afraid. Another thing that's going on is a lot of people are depending on the monoclonal antibody treatment. You know, guys, that's a treatment. You know, that's after the fact. You already have the disease. Now given, we are so thankful we have it because it is reducing a lot of severity of disease in a lot of people. But why on earth would we wait until we had to do that? We had to go get tested. We had to go wait until we could get into a monoclonal infusion site. And we'd sit there for an hour or so, for several hours in order to get that, when we could have gone and gotten a vaccine that took less than 30 minutes. From the time you got there, filled out your paper, got your shot, and waited your 15 minutes, and we cut up with you while you were there. You know, you could have had that, and you could have avoided all of the other stuff, plus the people in your family and in your community that you potentially exposed while you were doing that. So, and I will also say, a lot of us don't understand. A lot of people are still using home remedy kind of things. Once again, why would you pay a lot of money to go to the agriculture store to get ivermectin or whatever else? It's not even proven. And, you know, but you'd use it when you can go for free and get a vaccine at many pharmacies, and certainly at the hospital, and certainly at the health department. So, you know, I guess I'm kind of like Dr. Harris was 2 weeks ago. We're at the stopgap point that we don't know what else to say. We're going to be there for you as long as we can possibly be there for you. We're going to try to keep our nurses from quitting and leaving and going on strike. We're going to have vaccines. We're also going to do testing if it needs to be, just as they are. But quite honestly, Kelly and I, as well as the pharmacies, are facing a big load in the next couple of weeks. The potential is that the numbers are going to skyrocket even more than they are right now, and Kelly doesn't have space in her hospital to put these folks. There's not enough space there. You don't want to be in ICU in the emergency room. But, you know, we've got that going on. We are going to continue to give the vaccines. Kelly and some of her group are going to continue to do the monoclonal antibodies, and then we're going to continue to do the testing. We've already told you there's not enough staff to go around to do the things that we need to do, and we're going to add additional stuff to that, including probably within the next 2 weeks, booster doses that people are going to want. Now, that being said, let me tell you one thing that is happening that we hope is going to take a little bit of the burden off. The state health department and the local health departments have actually worked with a private vendor that is going to move into, first of all, Limestone County starting this Thursday, that's going to offer testing. And that's all they're going to do, is they're going to offer testing, and then with positive tests, they will make arrangements for people to contact their doctors for monoclonal antibody infusions if necessary. Hopefully less than a week from now, hopefully on the 13th, we're also going to start a site for 1 month here in Morgan County. It will be at the old fire station, 4119, and I can't read my own writing. So I will as soon as we know it's confirmed, we will let you know. And what we're hoping will happen in this, first of all, we don't want you to have to be tested. We don't want you to be exposed. We don't want you to have symptoms. We don't want you, but if you have to, please let the hospital take care of those that are sicker. Please let them do the monoclonal antibody testing. Please let us all do the vaccinations as much as we can to protect you as much as we can. And so we're hoping that this 1 month reprieve will give us a little leeway for Kelly's group and for my group to be able to do vaccinations and the other things that we need to do in order to protect this community. Now, on top of this, I need to add another little thing that has come up that is going to happen, and that is we need to start giving you flu shots. So, you know, it's time to get your flu shots. You don't need to have flu and COVID at the same time. You don't need to have flu and then have COVID, or vice versa. You just don't need to have both of them. So we will be giving flu shots within the next couple of weeks. You can take it in addition to your vaccination, or you can take it separately, and there's no required interval in that. So Please, folks, let's get on board. Let's take care of our community. Yes, the numbers, and I think Mr. Jacobs said it exactly correct. They're creeping up. They don't need to creep up. They need to jump up. They need to be where we need them to be in order for us to protect this community. Thank you for the opportunity to be here, and I'm sorry, I wish it was better, but we're going to try to tell it like it is, and hopefully folks will make the right decisions in this. Please honor the moment of silence for our fallen comrades in Alabama at noon today. Thank you.
Thanks, Judy. Yeah, when you were talking, just a kind of anecdotal story came to mind. I was talking to some friends that were hesitant to get the vaccine, and I mean, we all recognize people's individual personal responsibility and rights, but you're arguing against very compelling data, extremely compelling data that, especially, you know, with the hospitalizations and ICU and I don't understand, but there's really compelling data that says the vaccines work, and that we need to get them. So.
And Commissioner Ladner, there are more people that have taken this vaccine that have taken any vaccine in history in this period of time. It is a proven vaccine, and why not, if it's, you know, if it's not going to hurt you, if it's not going to be any, there's no more risk than that of taking aspirin and many other medicines that we take, why not give it a whirl and give this community an opportunity to go in the right direction?
Right.
So.
Kelly, I was going to tell this story too. I had a couple of people that ended up testing negative, which was good, but they went to the mobile medical unit at Westmead, and I think stories of people trying to get into doctor's offices and other things, there's long waits. They said it was just kind of a breeze. You go through and get your test results in about 48 hours or so. So that's working too. So thank you guys for that.
Good.
I'll kind of read this and then we can go to questions. So as of September 2nd, there were, I think we had more Alabamians on ventilators than ever in the history of the state of Alabama, from what I understand. So just kind of it is what it is, as Judy said. If you want to get vaccinated, you can visit the health department, the Decatur Morgan Vaccine Clinic, or go to vaccinefinder.org to locate an additional vaccine provider. And with that, we can open it up for questions.
Nothing on the phone? Dion, do you have anything?
Sure, I have one question for you. We talked earlier, it's football season and people are coming out for college games and grows. We're talking about 100,000 people. What's going to happen behind that?
People are taking those risks. You know, again, we want people to get out. We're all tired of being pinned up, and, you know, actually we wish our children could be pinned up in school because that's where they need to be. So, and we know that a lot of schools have been canceled. You know, people have the capability of protecting themselves. If you've been vaccinated and you wear a mask, going to the ball game is probably perfectly okay. But if you don't do either or at least one of those, then you're, again, what is the price we're willing to pay? You know, and a lot of these folks are the folks that are going to be seeing Kelly or my group within the next 2 weeks. We don't want them to be in the hospital. We don't want them to be on ventilators. You know, what price are you willing to pay for just some very basic, you know, just masking and as much, staying with your family, distancing as much as you can. So it's scary times. It doesn't have to be. If we were in any other war, we would follow what the commander-in-chief told us to do. We would follow, you know, and do what we needed to do. But for whatever reason, we just can't lose this war for 12,000 more people in this state. We just can't do it.
Yes, I actually had a few questions. Kelly, I wanted to ask you, what are the percentage of young people in Decatur Morgan Hospital under 18? And also with that, what are the percentage of kids under 18 that are vaccinated that are in the hospital?
Well, first of all, we do not admit pediatric patients at Decatur Morgan. So they all go over to Huntsville, to Women's and Children's. So I can't tell you how many are over there, but I know it's a substantial number in the Huntsville hospital system that are under 18, including pregnant women and infants. I don't have that number, but I could get it to you later if you want to. Yeah,
Yes,
I
ma'am,
can
that'll
get you
be
that number
fine.
later.
And my next question was, what are the most highly transmissible spots for COVID in Morgan County right now?
Everywhere. If you're in a group with people, I don't care where you are, If we're talking that the Morgan County rate is less than 40% vaccinated, then chances are 60% of the people that you're around are not vaccinated. And so, it's a danger zone. You need to play it safe no matter where you go. I don't care whether it's the big box stores or whether it's your work unit. You need to play it safe. I do want to add something to what you asked, Kelly. There are currently 26 children at the Children's Hospital at UAB in Birmingham. And
What was that
5
number
of
again?
those children, sorry?
What was the number again? I'm sorry.
There's 26, now that may have changed this morning. There are 26 children in Children's Hospital, and 5 of those children are on vents. Now, let me tell you about scary. Have your child on a vent. It's bad to have your adult relative on a vent, and the pictures we've seen are true, but have your child on a vent. That's a terrifying situation for any parent, and we as the adults who can take the vaccines, we as the folks over 12 years of age who can take the vaccine, we're the ones that need to be protecting all of those children.
And lastly, you mentioned that 16% of people in Decatur Morgan Hospital were vaccinated. What is the percentage of breakthrough cases that we have right now in Morgan County?
I don't have that number.
The percentage of breakthrough cases in the state, I don't know about Morgan County, is less than is about 0.5%. But now, saying that, I think people like to use that as an excuse for not getting a vaccine, but keep in mind that many people who've taken the vaccine are very high-risk individuals anyway. In fact, one of the things that we're doing right now is we're giving 3rd dose vaccines to people who are immune suppressed for the very reason that it's become clear that they didn't have the stimulation of antibodies that that hopefully the rest of us did. And there have been particularly a lot of breakthrough cases in folks who are immune suppressed. Again, the reason for the 3rd dose. So.
Yes, ma'am. Thank you, guys.
Thank you.
Anything else?
That's it.
All right, another one next week. Okay, we'll have another COVID update Monday next week. Mayor Bowling will be back. Do y'all have anything else to add?
Thank you for
All right.
having us.
Yes, thank you.
Thank you.